This video has mnemonics for schedules of DNC Act 1940. So when you want to reserve a seat in a train, so you'll go to IRCTC where you'll do a couple of things. The first thing you'll do is fill up a form and then pay some money. So schedule A is the first thing you do, that is filling up a form. So it has specimens for prescribed forms. And then schedule B. Schedule B is the second thing you do, that is paying money. So it's about money, that is rates charged by CDL. Then comes schedule C like a ocean. So sea has many fishes, sharks, from which we derive many oils like cod liver oil, which is a biological product. So schedule C has list of biological products. Schedule C has list of biological products. The next one is Schedule D, D for DHL. So through DHL, we can send stuff to other countries. That means we can import as well as export. So this DHL people, they check and make sure this stuff we are sending are okay to be sent. So Schedule D consists of list of drugs which are exempted from certain provisions of import. So just remember that you can send these drugs to DHL. They exempted from certain provisions of import. Then Schedule E. What's E for evil? What's evil? Poison is evil. So schedule E consists of list of poisonous substances. Then the next schedule is schedule F. F like foreign. And so when we donate blood to the acceptor, blood is like foreign blood. So schedule F consists of requirements for operation of blood banks. And this schedule F is subdivided into F1, F2, F3 and FF. F1 has F1 is foreign again. What are the other foreign things? Vaccines and antisera. F2 is surgical dressing. Bandage is the commonly used surgical dressing. So when we peel the bandage, we peel it from two ends, right? So F2 and two ends. Then F3 is standards for umbilical tapes. Just remember this. And FF is for ophthalmic. Ophthalmic is for eye. So eye has something called focus. So we have two eyes. So two foci, so 2F and schedule FF. So next is schedule G. So when you go to a hospital, you don't usually go alone. You go along with a guardian. So schedule G consists of drugs that should be taken under medical supervision. That means you should be guarded while taking these drugs. And then the next schedule is schedule H. So to take schedule H drugs, you actually need to go to a hospital. So, and the doctor will prescribe these drugs in a prescription. So schedule H consists of list of prescription drugs. And these drugs come with a warning that, I mean, on the strip or package, the warning is to be sold only under the prescription of medical practitioner. And Schedule I is not mentioned in the Drug and Cosmetics Act. I mean, it's not there in the Act. And then the Schedule J. J means Japan. And when we think of Japan, we can always think about the atom bomb. And this atom bomb has brought many incurable diseases to then citizens. And so Schedule J consists of list of diseases which cannot be cured. And the next schedule is Schedule K. The most irritating reply over phone is the letter K, which means okay. So these drugs are okay to be manufactured. So Schedule K consists of drugs which are okay to be manufactured. That means they are exempted from certain provisions of manufacture. And the next schedule is Schedule L, which is not mentioned in DNC Act. And the next schedule is Schedule M. This is known to everyone. It's GMP, Good Manufacturing Practices. M for M. Just remember M for M. And the next schedule is Schedule N. This is the schedule which is not being followed. I mean, no offense, the people who follow it. So, Schedule N is minimum requirements for running a pharmacy. There are pharmacies without a refrigerator, air conditioner, and the next is Schedule O, which is standards for disinfectant fluids. So, commonly used household disinfectants are Dettol, Lysol. They all have the letter O in them. So, and next one is Schedule P. P for P, life period of drugs. And then the next schedule is Schedule P1. P for P again, this time pack sizes of drugs. The next schedule is Schedule Q, which has list of colors, dyes and pigments which are permitted in soaps and cosmetics. There's a dye or pigment called quercetin. It starts with the letter Q, quercetin. So remember Q for Q. And then Schedule R, standards for mechanical contraceptives. They're usually made of rubber. So remember R for R. And then the next schedule is Schedule S, standards for cosmetics. And we always say yes to cosmetics, so S for S. And the most commonly used cosmetics are shampoo, soaps and sunscreen, all start with letter S. And then Schedule T, good manufacturing practice for Ayurveda, Unani and Siddha. This dosage called thylat, so T for T. Then Schedule U for urgent. So what do we do urgently? Write records before practical exams. So schedule U is about records. And then schedule V, V for victory. What's the ultimate victory for a pharmacist? That is getting patents and proprietary rights. So schedule V consists of list of patents and proprietary medicines. So when you go to a foreign country, there are new people around you and you're kind of scared, and being scared to new things is called as xenophobia, which is a psychological state. So Schedule X is psychotropic substances, Z for xenophobia, psychological condition. And when you think of the letter Y, you always think of the animal yak. Where are animals used? They're used in clinical trials. So guidelines for clinical trials.